Hi, everyone. Welcome to Center of Balance and AQTCM Live. I'm Sunan Puan, of course. I've been doing that every day with you guys. I'm pretty sure you know who I am. I'm an acupuncturist and Chinese medicine herbalist. I'm Malaysian, but who work in Center of Balance in Dunsdale, Hamilton, and we have a clinic in Auckland, Remuera as well. We have a team to work with for you if you come to see us. So today, what is my topic today? So my topic today is pretty simple. It's about infertility, female infertility. So we talked about 2 days ago, I think we talked about the topic of medications and drugs and medical conditions that cause male infertility. Yes, today we mainly focus on medical conditions, medication and drugs that cause female infertility. Now we have a variety of, let's start from medical conditions first. A variety of medical conditions can affect the female reproductive system and cause infertility in women. For examples, that include, I'm going to name about six, I think 6 of them. Yep. So the first one is ovulation disorders, which you may hear a lot. That people say that I have PCOS. What does PCOS stand for? It is polycystic ovary syndrome or hormonal imbalance. That causes that if you suffer from let me talk about this. People keep saying that they have PCOS. PCO and PCOS are 2 different things. PCO is the cysts, a lot of cysts, or 1 or 2 cysts that in your ovaries that need to go through a skin to be able to figure it out. Without skin, you can't be diagnosed as PCO. PCOS symptom, which means you have a lot of symptoms that, as well as skin that been proved that they have cysts in your ovaries. I hope that makes sense. Yeah. What sort of symptom is that in here? Put on weight. Excess hair, a hairy in the tummy, below your belly button, and some hairy over here. Yeah, you find that increase more here. What else? Irregular period, painful period, etc. The second thing is pelvic inflammatory disease. We call it PID. Number 3 is endometriosis. Number 4 is uterine fibroids that cause bleeding, right? Number 5 is premature ovarian failure. That means that you haven't got enough eggs. You can't produce eggs. The egg quality is not good, There's some tests to run for it. Number 6 is scarring from a previous surgery. Yes, when there's surgery in your uterine, it actually prevented implantation. So that's implantation issues you can think about. So I've got very, very itchy nose. Okay. So those 6 things are very common when we see female infertility. Okay, let's move to medication and drugs. Oh, before I go there, I would like to tell you that every time we do a live video, we're going to do a small part to give you, if you're a patient, just give you some information, what's going on in infertility. We have a lot of other topics. We will come to treatment as well. It'll come to acupressure point, what you can do from home, and how does acupuncture and Chinese medicine will be able to help female infertility, things like that. If you're an acupuncturist, I know you know all this. Some of you know if you specialize in here, but if you want to learn more, please follow me, because you get a lot of information from me, and I'll suggest some points and we'll talk about Chinese herbs. Then you get some idea, and also you can join our online courses, and we'll be able to help you more, to show you how to treat it, and you can learn from our clinic. I want to talk about this organ chart. So in Chinese medicine, what I name about those 6 causes of the medical conditions, we can treat that. We definitely can treat that. All right, we'll be able to do that for you. What's that? That's the organ chart, organ theory in Chinese medicine. Everything comes from imbalance of the organs. Now, as you can see here, this is kidney and bladder. Our kidney function in Chinese medicine, it controls reproductive system. So what I just mentioned, all of these conditions, it actually can cause from kidney. So we need to check your kidney function. The second organ in here is liver. Liver meridian directly connect to uterine. So that's another important organ we need to check. Whether it's that one or that one, then we have to go through initial examination to figure out what's going on and which one and how to treat, things like that. Then it doesn't mean the others are not important. The others are also very important. It could be a combination imbalance that causing infertility. So not just one organ. Most of the time we see multiple organs imbalance, out of balance, causing that. Okay, so this theory is very different. I'm going to talk about that in treatment more in Chinese medicine in the future, and how we can help with that. Right, let's talk about medication and drugs. So certain medications and drugs that can affect female infertility, that include, I'm going to name about 4 of them. Chemotherapy and radiation therapy. So that is common, very common. We mentioned that in male infertility, that also in female infertility. So that is why people, I see more common in male infertility. Before chemotherapy, they get the sperm out, they get the eggs out, and then prepare for IVF. For female, yeah, you can do that too. I don't know. I haven't seen a lot of cases in female infertility that they get the eggs out before chemotherapy, prepare for IVF, but we do see male infertility. The female came in for treatment, and one of the reasons they went to the main reason that they went for IVF is because the husband suffered from cancer and going for chemotherapy and radiation therapy that kills sperm. But anyway, chemotherapy and radiation therapy does affects eggs quality. That's kill eggs too. Okay. The second thing is long-term use of high doses non-steroid anti-inflammatory drugs. We short it as NSAIDs, such as common drugs that you know, aspirin and ibuprofen. Now, people use those two, very common if you're in pain, muscle pain, joint pain, and use that for pain relief. Then if you take it 1 or 2 days, I don't, or occasionally, that's pretty okay, acceptable. We won't say that, well, that's going to affect your eggs and things like that. I know very common people take that. It's long-term use. Long-term use means every day, every week. You may not take it every day, but you take it once, 3, 4 times a day. So if you are preparing for pregnancy, then you find that you can't, wow, why can people get pregnant so easy and we can't get pregnant? Then you need to ask yourself, are you on aspirin or ibuprofen often? May not be every day, but if it's every day, definitely check it out. Definitely sort out the pain. Acupuncture, Chinese medicine, chiropractor, osteopath, physiotherapy, or massage therapy, they're very good for pain relief. So sort it out first. Sort it out, get it sorted out, and stop the aspirin and ibuprofen. I do have patients come in. They didn't know that. Even nurse, they didn't know that. This is one of the main causes. They say, oh, I have neck pain, I have migraine, I have headaches every day. Every day I'm just taking ibuprofen and they fix it. And they've been doing it for years. I said, wow, we need to sort out your headaches. You need to stop ibuprofen because they've been proved that it's one of the medication cause that affect your cause the female infertility. They didn't know that. Okay. Next one, antipsychotic medication, right? So depression or anxiety. So some patients do take this patient. I'm not saying all of them that can affect. We do have patients that been taking antidepressant drugs for years, and they come for they just have to be on the drugs, and we help them to reduce or stop. But some of them they just can't, but they do get pregnant, right? I'm not saying that's 100%. As long as if you take those drugs, you can't at all. But I mean, is if you can avoid that, that would be better. But not just stopping it directly or yourself. Do consult with your doctors, right? Your GP, your MD, and do get helps like acupuncture, Chinese medicine, and do meditations or yoga, or there are a lot of things that you can do, whatever can relax you. People find exercise relax them and go for that. And then once you more stabilize and you slowly cut down the medication, if you are trying or preparing for conceive, but you find it difficult, and that may be one of the cause. Okay, I'm not saying 100%, but it may be one of the cause, and you need to consider to fix your emotion problem, and then get a more your emotion and more stable first. Again, look, when we talk about emotion here, what are we talking about? Heart, small intestine out of balance, get unhappiness. You can't enjoy your life. Stomach, spleen out of balance, you get anxiety. Lung, large intestine out of balance, you get sadness. Kidney, bladder out of balance, you get fear. Liver, gallbladder out of balance. What do? You get depression, irritability, stress, impatience, you know. So all this in anger. So all this thing, you may get it from organs imbalance. So in Chinese medicine, acupuncture, we actually figure out what organs out of balance, and then rebalance the organ, then you'll be fine. Right. So last one, the recreation drugs such as marijuana and cocaine. Yep, you're right. I know a lot of people use it from time to time. They may not use it every day. I do have patients use marijuana every day. That is because they're in such a lot of pain. A lot of things that hasn't been helping. They try a lot of things that haven't been helping, but the best thing they think they said about is marijuana. I do understand why they on marijuana, but if you again, if you try to get pregnant and you often use marijuana, please stop it. They're not good for you at all. We're talking about female, but that thing is the same as male, right? And cocaine, yes, we all know it. So if you want a healthy baby, please stop those recreation drugs, okay? All of them, right? Now, according to some research, ovulation problems cause around 1/4 of the infertility issues seen in couples. Yes, so when we treat female infertility, we look at the chart, and then we get you take BBT, basal body temperature, every morning to figure out how your ovulation will be. We should talk about ovulation one day, just ovulation subject, and show you how to take the BBT. Okay. If you're interested in that, please let me know and put down your details in there and let me know how you would like that topic, and I'll be able to do it for you. Yeah. Whether you're an acupuncturist or a patient, if you want to know more about BBT, you can schedule one day and to talk about that. So in irregular and or absent period are two signs that a woman may not be ovulating. Yes. So when you ovulated, if you're not, when you ovulated, if you pregnant, then you miss your period, right? We all know that. That's very common knowledge. If you ovulated, if you're not pregnant, then you miss your period. That's the problem. That means because ovulation, after 2 weeks of ovulation, you get your period. But if I think, did I say it wrong? I think something is, I didn't say it properly. Let's correct myself again. Now, ovulation, you get pregnant, then you stop. You don't get pregnant. Period, bleeding. Ovulation, if you don't get pregnant, in 2 weeks' time, you get your period. Okay? Now, ovulation, if you don't get ovulation, you don't get your period. That makes sense? Yeah. So most people think about that way. This all doctor and most people, but they may not be true, okay? Because ovulation, I want to tell you that ovulation has a link, a connection to period. But it's not 100%. We can't say 100% sure that when you ovulation, you do get your period after 2 weeks, okay? But most of the time, because when you ovulation, that the hormone change, you get the right hormone, and then you get your period. They are more complicated in here. Okay, we do see people up and down. You can't see whether they ovulation or not, or you can't see they are not ovulation on the chart. Okay, they do get pregnant. But one thing that is very important here is a common sense. You see breastfeeding mom, breastfeeding, they have a child, breastfeeding, they don't get a period, then they're pregnant, which means while they're breastfeeding, they don't get period, right? There's still ovulation. Otherwise, how could they get pregnant? So that is another thing that's very interesting, and a lot of people don't talk about this. You see, a lot of people don't never talk about this, but this is we've been discussing this in Chinese classic book. Okay, that's it for today, and thank you for joining in. And please say hi to me, and then put your details down there if you want me to talk about BBT chart. If you're an acupuncturist, we do have acupuncture super 10. And you can ask a lot of deeper questions, and I'll be able to answer you. And we do have a infertility part that showing you how to treat infertility patient. You can join our program and drop your name down and let me know you want to join, or DM me. If you're patient, hey, we can help you no matter where you are. We can do online consultation, initial consultation, and give you prescription, and we can even send herbs to you, or you can buy in the local Chinese medicine shop, and we can show you acupressure point and moxibustion, how you can do it at home. Or we can't give you acupuncture if you're in overseas, but instead you do moxibustion and acupressure point, and we can search which clinic are good around you that you can go for acupuncture if you need it. We definitely can do herbs for you. If you're in New Zealand, hey, we have clinic in Wimmera in Auckland. We have clinic in Dinsdale, Hamilton, and we'll be able to help you come in for initial examination. It's only $40. Everyone can afford it, and we give you a plan. We let you know how we can help you, how much it's going to cost you, and how long it's going to take. Something like that. I am going to join my book club in 7 minutes. And that's it for today. Thank you very much. Bye-bye.